Everybody, thanks for tuning in to another episode of our weekly live stream. My name is Duke, and I'm with LPT Medical. November, as I'm sure most of you know, is COPD Awareness Month, so we are going to be focusing a lot on COPD over the course of this month, whether it's tips to make your everyday life easier, treatment adherence, what to do with your oxygen concentrator when you're traveling for the holidays, whatever it might be. Everything that we're doing is for COPD Awareness Month to help bring awareness to COPD. And then not only just bringing awareness, but helping you better manage your disease, keep your symptom severity to a minimum, all that good stuff. So when it comes to treating your COPD, one of the most important aspects of effective disease management is careful adherence to your medication regimen. So that means taking your medication exactly as prescribed by your doctor at the same time every day to make sure that that medication is as effective as possible. Using your oxygen exactly as prescribed. If it's 24/7, using your oxygen 24/7, not only when you're exerting yourself. If it's making changes, specific changes to your diet and exercise regimen, all of these things are extremely important. Today, we are going to be focusing on adhering to your medication treatment or your COPD medications, adhering to the treatment plan, and we're going to go over what types of what types of medications are more common with COPD patients and what they do. And then we're also going to be covering when you should speak to your doctor, because sometimes medications do lose their effectiveness over time. So let's just dive right in. Not everybody's going to have to use these medications. It's all dependent on a person-by-person basis and how your disease is affecting you. Number one, you see it a lot. It's oxygen, whether it's a portable oxygen concentrator like the Respironics Simply Go, the Energen 1 G5, liquid oxygen tanks, supplemental oxygen tanks, or a home concentrator. Typically, you're going to be prescribed oxygen if your oxygen saturation levels are regularly below 90%. Your doctor is going to make you do a 6-minute walk test where you're walking back and forth for 6 minutes. He or she is going to monitor your blood oxygen levels to determine, do you need oxygen and how much oxygen do you need? The benefits of breathing in medical grade oxygen, they're really imperative, and they're really important, because when your oxygen levels dip below that 90% and you're sitting in the 80s and then it's going down in the 70s, not only are you not able to breathe, but you're going to be causing some damage to your internal organs, not just your lungs, but your heart's going to suffer when it's not getting enough oxygen. Your body's not going to be working at its optimum efficiency when you're not getting enough oxygen. So by breathing in prescribed oxygen, it increases the amount of oxygen in your blood. It reduces the extra work of your heart, and it will help decrease the feeling of shortness of breath. It's not going to alleviate it completely. As I'm sure most of you know, when you're on oxygen, sometimes you can still feel breathless. But that's typically not because of the oxygen coming in. That's usually because it's harder for you to expel all of that air out of your lungs from the damaged alveoli. Next one is bronchodilators and anticholinergics. Sorry about that. That's a tough one for me. These both relax the muscle bands that tighten around your airways. This action opens the airways, which lets in more air in and out of the lungs. Like I just mentioned before, a lot of the times when you're feeling breathless, it's not because the air is not coming in, it's because you can't expel all of that air out. So these are going to help you move air in and out. Bronchodilators also help clear mucus from the lungs, and as your airways open, the mucus moves more freely and therefore can be coughed out easier. Next is leukotriene modifiers. They might be used. Leukotrienes are chemicals that occur naturally in our bodies, and they cause the tightening of the airway muscles. That also helps produce more mucus and fluid. So by taking the leukotriene modifiers, you can help reduce that tightness and that mucus production. And as And like I said, these medications will help improve the airflow, and they might also help reduce symptoms in some people. This next one, anti-inflammatories, very, very common, especially with COPD, because you're dealing with inflamed airways, which can make it harder for you to breathe. So anti-inflammatories are going to reduce swelling and mucus production in the airways. As a result, your airways are going to become less sensitive and less likely to react to triggers. The anti-inflammatories do need to be taken daily for several weeks before they actually begin to help control your symptoms. So if your doctor just put you on them, or if you're just starting out on them, it's not going to be an overnight success. Your body has to get ramped up and get used to these. And by, like I said in the beginning of the episode, taking your medications as prescribed at the same time every day, so you're on a schedule and your body knows when to expect that stuff. So the anti-inflammatories are going to lead to fewer symptoms, better airflow, less sensitive airways, and less airway damage. Next on the list, expectorants. Expectorants are very common as well. Your doctor might recommend that you take them. You can get some over the counter, or you can get prescription expectorants. What expectorants do is they thin mucus in the airways so it can be coughed out more easily. You're going to be taking these medications with about 8 ounces of water to make mucus easier to clear. Just a little tip, warm liquids typically work best to help dislodge that mucus. Next, antihistamines. We've talked about antihistamines and histamines on this show multiple times. Antihistamines are going to help relieve stuffy heads, watery eyes, and sneezing. Although they're effective at relieving these symptoms, antihistamines can dry out your air passages, which can in turn make breathing a little bit more difficult, as well as cause difficulty when trying to cough out the excess mucus. Take these medications with food to reduce the upset stomach. Some of these medications, they may cause drowsiness, so make sure that you take it and understand how you feel and how it makes you feel. If you know that it's going to make you drowsy and you are going out and running some errands, it might be best to wait until you get home, so that way you aren't in danger of falling asleep behind the wheel or anything like that. Next, antibiotics. Antibiotics are typically used to prescribed to treat infections or help you recover from an illness. I've harped on this a lot on this show. Getting sick with something like the cold, the flu, getting a sinus infection, pneumonia, all of those can be really detrimental when you're living with a respiratory disease because the symptoms typically pile on top of each other. So cold, flu, sinus infection, all those can cause you to cough, make it harder for you to breathe, increase mucus production. So you're going to want to talk to your doctor if you're not feeling great, if you're experiencing any of those, to see if antibiotics might help. When you do get prescribed antibiotics, and it's important to take the antibiotics for the full time of your treatment, even if you start feeling 100% back to normal and you still have some of your prescription left, don't save it, don't throw it away. Just continue and complete that treatment so that way you can be 100% healed and back and ready to go. If you're familiar with exacerbations, or if you've experienced an exacerbation, antibiotics are typically prescribed at the end, whether it's some steroids, I always do this. I always forget the steroid's name. My dad takes it. Prednisone. So a lot of times they'll provide prescribed prednisone, which helps with after the exacerbation, along with another round of medication geared towards your illness. Antivirals, they might be prescribed to treat or prevent an illness caused by viruses. Most frequently, they're prescribed to prevent influenza or the flu. Influenza is particularly dangerous for those who have COPD and other respiratory conditions. I've talked about that countless times on our live stream, and if you go to our blog, you'll see tons of information about how dangerous the flu can be and how important it is for the next thing, which is vaccines. When you're living with a respiratory disease or a chronic autoimmune disease, whether it's COPD, cystic fibrosis, pulmonary hypertension, Vaccines are extremely important that you get them on a yearly basis. They're going to help you prevent infections, especially the flu shot and the pneumonia shot. You might even want to speak to your doctor about a whooping cough vaccine. The flu vaccine should be taken annually in the early fall, but the pneumonia vaccine is only needed once after the age of 65. Only needed once after the age of 65, yeah. So I just listed off a bunch of these medications that you might need or that you might get prescribed over the course of living with a respiratory disease. But like I mentioned at the start of the show, some medications do cease to be effective or they require dosage adjustments. So if you begin to feel that your medications aren't alleviating your symptoms like they used to, you should speak to your doctor immediately. Let them know that, yeah, your symptom severity is starting to get worse, even though medication A or B has been helping suppress it and keep it in check. But not only should you speak to your doctor when your symptoms get worse or when your medication doesn't seem to be as effective, you should speak to your doctor when your symptoms get worse. Like if you're feeling more breathless, you're having more coughs, coughing attacks. If your mucus production has increased or your mucus has become thicker or changed color, a lot of those are signs of an exacerbation. And the earlier that you can catch an exacerbation, the better off that you are, because you're going to be able to treat it more effectively, and chances are you might be able to prevent a hospitalization from that exacerbation. Next, if you notice that you have increased fluid retention, this is also known as edema, you're going to want to speak to your doctor. Edema, for those of you who aren't familiar, or fluid retention, if you notice swelling in your ankles and it's not your ankles aren't normally like that, you see them swelling a lot, that's typically a sign of fluid retention. Speak to your doctor immediately, as it may indicate that you might be having some issues with your heart. If you start having morning headaches each morning when you wake up, this could indicate that your oxygen levels are dropping overnight. It could mean that you might need supplemental oxygen at night. You might need to adjust your oxygen settings at night, or it could also mean that you might have sleep apnea. So if you notice that you wake up in the morning with a headache each morning, speak with your doctor about that. That way you can get a plan of attack going. If you notice that your vital signs have changed, whether it's your blood pressure or your heart rate, these are all signs that your medication or your body might not be processing your medication effectively, and your electrolyte levels can be affected as well. So it's important to have your blood pressure and your electrolytes checked every 6 months, or as your doctor recommends. If you aren't sure if your blood pressure is in the right range, speak with your doctor, and then you can always get an at-home blood pressure monitor. They're very simple and easy to use, very cost effective. It'll also help give you some added peace of mind. Thrush or mouth infections, these are actually very, very common with respiratory patients, simply because when you're taking your inhaler, whether it's a bronchodilator, a rescue inhaler, anything like that, you want to make sure that you are rinsing your mouth out after each dose. That way you get the medication, but it's not just sitting there on your tongue. That's going to be a breeding ground for thrush. So if you develop irritation in your mouth or you notice patches on your tongue, you could have a mouth infection. So speak with your doctor if you notice any of that. And then also rinsing with salt water can definitely help. Next on the list, stomach problems such as nausea or diarrhea. Sometimes this can be alleviated by taking your medication with food. But if your medication is regularly upsetting your stomach, you should speak with your doctor about changing or making a change before it's causing some excessive weight loss, simply because low body weight can make you feel weak and tired, and it also makes you more susceptible to illness and infection. With that being said, that kind of concludes our episode for today on the different types of COPD medication, what to do when you feel like your medication isn't as effective, and then just some little tips on when you might want to contact your doctor if you notice something isn't right with your body. So with that being said, do we have any questions, Lisa?
Neil, he doesn't have a question. He just said it's good to see LPT Medical again.
Thanks, Neil. Appreciate you tuning in. We really appreciate that. If anybody has any questions and you're not watching while it's being recorded live, please leave a comment with your question below. We're going to get back to everybody that has any questions or any comments. We love hearing from you guys. It really makes us happy, and any way that we can help, that's what we're here for. So Before we end the episode, I wanted to talk to you guys about the Respironics Simply Go. We have quite a few of our refurbished Simply Goes in stock and available. We are trying to make room on our shelves for another shipment to come in. So we have some refurbished units as low as $1,199. These units are factory refurbished. They come with a full 1-year warranty. They offer pulse flow and continuous flow settings, so it can be used 24/7, even if you have a CPAP or a BiPAP machine. On a setting on continuous flow, it offers 0.5 liters per minute up to 2 liters per minute. And then on pulse flow, you can operate this machine on settings 1 through 6. So it can be used 24/7. Like I said, we are a little overstocked on these, so we're trying to move some out to make room for some new shipments coming in. $1,199, that's $1,199 for basically it's basically brand new, but it's a factory refurbished unit. All the brand new internal parts. It just has an old casing. It's an amazing unit. It's one of the most popular continuous flow units on the market. So if you have any questions about the Respironics Simply Go Mini, or if you need to get a portable oxygen concentrator for just $11.99, give us a call at 1-800-946-1201. Any of our respiratory specialists are going to be able to help you out with this. Like I said, we do have quite a few in stock. So $11.99, we're trying to get these out the door. You can give us a call at 1-800-946-1201. It comes with 1 to 2 batteries, depending on the package that you want to get. And it also has a sleep mode technology. So if you happen to doze off while you have it on pulse flow, you're going to still get your oxygen while you're using the machine and you fall asleep. So with that being said, that's going to conclude this episode of today's live stream. I really, really appreciate you guys tuning in. Like I mentioned before, this month is all about COPD Awareness Month. So tune in next week for another great episode that's going to help bring awareness to COPD and help you better manage your disease. Thank you very much for tuning in. I'll see you next week.